It's often said, nothing you wear is more important than your smile. So if you've been questioning how you can improve yours, our next guest has the answers. Dr. Brian Kvitko of Dr. Kvitko Associates has been awarded the Consumer's Choice Award from 2009 to 2018. He joins us now with the many ways that you can make your smile more beautiful. Thank you for joining us.
Thanks for having me.
Congratulations on the Consumer's Choice Award. What does that mean for you to earn that award? So many years.
I know. No, it means a lot because people don't necessarily think of dentist and something they like. So to know that even though I'm a dentist, people were saying nice things or have been saying nice things is really rewarding.
And that's wonderful. So first off, let's get into some of the services you can provide. If you have a patient who hasn't been to the dentist in a while, might be a little nervous, you offer a service called Sedation Dentistry.
Right. I've been doing sedation since 1985, and we offer something as simple as laughing gas, which would be like having a couple beers, oral sedation, which is tablets that you swallow, which would be like La La Land, or IV sedation, which is wake me up when it's over.
Sure, that's what I would go for, yes. So now if a patient has maybe discolored or chipped teeth, might have some missing, what can you offer them?
Well, besides if they're discolored whitening, we also can do porcelain veneers. That will allow us to, it's like fake fingernails for teeth. We can put anything, you know, we can just make it look gorgeous and it looks natural. I don't know if we have any examples or not, but I think we might. And so, yeah, crooked, undersized, oversized, you know, rounded edges, squared, we can change all that and make it gorgeous.
Sure, here we've got a
there
picture
we go.
here, yes.
Okay, so see the gap was closed in and the front 4 teeth are the only teeth that we did. We first moved them orthodontically a little bit, brought the front 2 teeth together. Of course, that creates a gap on the other side of those teeth. And then we put porcelain veneers on the front 4. So if you hadn't seen the left picture, you wouldn't know that that person, you know, had that, right?
That is great. And you also offer the 6-month smile makeover.
Yeah, well, 6-month smiles it's called, which is orthodontics basically, but it's done in 6 months. Most of our cases take about 4 months, 4.5. And I think every adult would like straight teeth, but no adult wants to have braces for 2 or 3 years, right?
Sure.
So when we show people what we can do, see that's like 5 months.
Sure, so that's the progression over the 6-month period?
Well, the top is the before and the bottom is the after from different views. So we're able to take somebody and give them a gorgeous smile, and we didn't have to do any veneers or anything on that smile, we just whitened it and straightened them. So it's hard to believe, people don't believe you can do it so fast. They're always asking, how do you do it so fast? Well, look at that one. That one, besides bringing those front 2 teeth out and the other 2 back a little bit, I also did some tissue contouring of the gums and made it look, you know, just the way you would expect. So, and again, that was about 4.5 months for that.
4.5 months, really? Wow. Yeah. So it doesn't take that much time if somebody thinks it might be really long, like the 2 years in braces.
Right. I think anybody could put up with that for just, you know, 4 to 6 months.
Sure. So now if you have a patient who suffers from tooth sensitivity, from exposed roots, you offer gum grafts.
Yes. Now it's not just for sensitivity, but that's one of the reasons we do it. Gum grafts can be, you see, when you have recession, the root now is exposed, and the root is covered with dentin, not enamel. Well, dentin doesn't resist tooth decay like enamel does, and so you can get decay at the gum line of your teeth. That's not good. You can also lose the gum, and the gum is there to provide protection to the teeth and keep the bacteria from getting down between the outside world and the inside of your jawbone. So if you don't have gum there or enough, that's what happens, and you can actually lose teeth. So it's physiologic and cosmetic that we're doing it for. Oh,
sure, definitely important. And something else you've often dealt with, a benign bone growth in the mouth?
Oh, yeah, this
How
is
common is that?
It's pretty common. I just did another one. These people don't even realize that not everyone has these. There are these lumps, usually on the roof of the mouth, a big glob of something, right? It's hard. See that on the side there to the left?
Sure.
All that is bone covered by gum, and it actually was so big it was making the sides of her cheek protrude out.
Wow.
On both sides. The left is before and the right is after. I actually have a picture. I hope it doesn't gross people out, but I took a picture of me taking it off. I think that might be coming up. And so close your eyes if you don't like seeing.
I think we took that away. We took that away because it was pretty gross. We were looking at it with my producer Julia too, and we said, "Ooh, that might be a little too much for the viewers."
We weren't sure, but anyway, I thought it would be fun. Maybe I'm not affected by that kind of thing because. Anyway, so
it's Halloween blood and gore, but I was like, "Ooh, that's a little."
That's fine. That's fine. So anyway, yeah, and so it can be an issue when you're trying to get x-rays. If you have this big blob of bone on the side, it's called a torus. Well, you can't put the x-ray in and it hurts. Okay. Or sometimes your tongue is confined because you've got this bone growing almost to the middle. In the case of that woman, it was making her cheeks stick out, you know. And most people don't know that it's not normal because they grew up that way.
Sure.
So if you're one of those people that has that, I can tell you it's not normal and it can be dealt with, and it's pretty simple. It's really simple. You don't have to be sedated, but we can sedate you if you want to be.
Sure. And I think we've got pictures of the veneers then next to you, or the dentures.
Oh, let's see. We'll have to see. Yeah. So anyway, there you go. Okay, this is implants.
Oh, the implants, yes.
So this person had no teeth at all. I placed 2 implants. You can just see the little buttons there. And then what we did is we put the abutments on. Those are the implant with the cover screws. Then we put the abutments on. Then we put a bridge on that. And our bridge had little rings on the back. And so that would allow the partial denture that's removable to snap in. And you don't see any clasp. So this is a little bit less, there's the before and the after. That's a little bit less expensive way to do implants. If somebody wants implants but they can't afford a whole mouthful, well, with just 2, I was able to do that for her upper. You see what that upper smile looks like, isn't that cool?
That's absolutely
kind of changed her, didn't it?
Yes, exactly. And are you accepting new patients?
Oh yes, yeah, we're always accepting new patients. Here's the reason, because people have asked me about that. If I'm doing my job right, then I get you healthy. And all you need is a cleaning twice a year, every 6 months or so, right? Maybe an occasional little cavity here and there. So by doing our job right, we kind of need you to send your friends and family, you know? And so we always are accepting new patients, and we treat everybody like gold, and we do our best to make sure everybody's comfortable. And it's just a fun transition from people coming in nervous, and you can see them going from almost a curmudgeon, like standoffish, right, because they're afraid, they've been hurt, to within just a few visits, sometimes just 1, they're like all relaxed and they tell us how we made them feel at ease. So.
Well, wonderful. drkvitko.com, the information is on your screen for our viewers to contact you. Thank you so much for joining us today.
Thank you for having me. Welcome to the show. Congratulations.
Thank you so much.
It's really cool. The show's growing.
I'll see you again. Yes.